that the Mason Trichrome stain provides evidence that special stains can be used to enhance the subtle changes in the Minipig urinary bladder.
Hi, my name is Anastasia Penrod, and I am sitting with Stephanie Rivera to talk about her 2025 NSH Poster Comparative Assessment of Routine H&E and Mason's Trichrome stain to differentiate normal from infected urinary bladders in Göttingen Minipig. Welcome.
Thank you.
So, tell me a little bit about why this topic is exciting to you.
Well, it's exciting because this was a project that I was assigned at work, and also bladder infections are the most common type of urinary infections, and if left untreated, it could spread to your kidneys and to your blood.
What is your favorite part of this poster?
The images.
The images?
Yes, because I like, H&E, I just like the purple and the orange, but also the Mason Trichrome has the colors.
So tell me
it's
about
not
that.
as intense as I would have liked it to be as if on my poster. Usually the red is more vibrant, but that's what I like most, the images and how it came across in Halo when it transferred over into the Halo system.
So tell me more about the Mason Trichrome and why you selected that stain in particular for your research.
Well, in reading the pathologist's report, he kind of spoke about fibrosis throughout the different doses in his evaluation, and Mason Trichrome is a special stain that demonstrates fibrosis.
Is that, in your opinion, the best choice? If you could do this again, would you have chosen the Mason Trichrome?
No, if I do it again, I would choose the Preclinical Series Red, which is a better fibrosis stain. It's more vibrant, it's darker, and the colors would come up even more as far as demonstrating fibrosis in the urinary bladder.
And I bet those pictures would be gorgeous.
Yes.
What other challenges did you face doing your research?
Well, I think with trying to come up with a single message, that the audience can take away. So as I was writing, I was condensing it down like, okay, well, what do I want them to take away from it? And with my title being H&E versus the Mason Trichrome, just kind of like how the Mason Trichrome, which is a special stain, can provide demonstration to show subtle changes in the urinary bladder versus the H&E. So it can be used as a tool to enhance the demonstration of the different cells and the subtle changes, because some of the findings of the pathologist was fibrosis, thickened arteries, and epithelial metaplasia. So the Trichrome, I just think that would be a message that it can enhance and be a tool used to complement the hematoxylin and eosin, which is a routine stain.
So in a clinical setting, we could apply your research, correct?
Yes. Well, the Minipig is a model used for clinical trials for human urinary bladder disease, because the Minipig's urinary bladder and the human urinary bladder are similar in anatomy. So that demonstration, whatever they come up with as far as the methods development, so for the maximum tolerated dose, the Minipig experiment could be used in clinical trials for the humans because the anatomy is similar. And it could help with determining the maximum tolerated dose in clinical trials for anyone with bladder infection.
So in a hospital, could a clinician actually use this information on a Mason Trichrome to help them diagnose bladder issues or urinary tract infections in humans?
Yes. They would use the Trichrome stain, or even better, the Preclinical Series Red stain, depending on the diagnosis that the doctor came up with. They could probably order both stains, so if they did end up having fibrosis, it would show.
So continuing on with that Mason trichrome and the picric serious acid,
Picroceres red.
Picroceres red stain,
Yes.
they both help visualize fibrosis.
Yes.
And that's something that we currently use or could be used in the clinical setting as well. And from reading your poster, it looks like this is a common problem, not just with pigs, but with humans and mostly the female population. Is that correct?
Yes, that's correct. Because females are the most who have urinary bladder tract infection. But although everyone can get it, men and even children can.
Children can get it. I did
yes,
not know
can get
that.
urinary tract infections. And it is used in the clinical setting as far as the doctors requesting Mason trichrome to help enhance the H&E stain to demonstrate fibrosis in urinary bladder or fibrosis in liver or whichever organ fibrosis can occur.
What would you say is the biggest strength of this study or of the project in general?
The biggest strength, come up with a takeaway message for my audience. And I said, well, what is the one takeaway I want for the audience? And it's just to let everyone know that a special stain complements and enhances the H&E, that the Mason trichrome stain provides evidence that special stains can be used to enhance the subtle changes in the Minipig urinary bladder.
Stephanie, it has been fantastic chatting with you and reading and learning all about these mini pigs and your study, and I appreciate you doing your research and helping out in the field with this. Is there anything else that you wanted to add?
I'd just like to say thank you to NSH and to you, Anastasia, for the opportunity to speak at this podcast.